My name is Mary Beth Howard, and I am an assistant professor at the Johns Hopkins Department of Pediatrics and Division of Pediatric Emergency Medicine. And I'm excited to share with you today a study on how infant sleep practices change during illness. We recently presented this work at the Society for the Advancement of Violence and Injury Research Conference. Sudden unexpected death is the leading cause of mortality for infants aged 28 days to 1 year. Unsafe sleep practices, such as sleeping on a couch or adult bed or co-sleeping, contribute to the majority of sleep-related infant mortality. Recent minor illness is often associated with a higher risk of sudden unexpected infant death. And while the mechanism has not been determined, a possible contributor may be a change in sleep practices. Caregivers often modify sleep environments in response to concerns about infant comfort, safety, and the need for closer monitoring. Understanding how infant sleep practices change during illness may help inform future targeted interventions to reduce SUID risk in this vulnerable population. So the primary objective of this study was to determine if caregiver adherence to the American Academy of Pediatrics safe sleep recommendations changes during times of illness. We also sought to examine if adherence to safe sleep recommendations changed from the time of illness through a 1-month follow-up period. We hypothesized that caregiver adherence to the recommended safe sleep practices would be lower during and after illness. To test our hypothesis, we performed a prospective cohort study with a convenient sample of caregivers of infants aged 0 to 12 months presenting to the Pediatric Emergency Department for illness. The surveys assessed sleep practices before, during, and after illnesses at 2 weeks and 1-month follow-ups. We also assessed adherence to American Academy of Pediatrics safe sleep recommendations at each time point. Differences in adherence were assessed using logistic regression, while Poisson regression was used to evaluate the change in the number of sleep practices for the selected participant characteristics. And so of 131 enrolled participants, 106 completed all follow-up surveys. Adherence to the American Academy of Pediatrics recommendations was low, less than 10% across all time points, but decreased notably during illness without significant increase following illness. Bed sharing increased from 57% before illness to 68% during illness and remained elevated at 1-month follow-up. Additionally, sleeping in a crib or pack and play decreased from 61% pre-illness to 48% during illness and remained low at follow-up. Caregiver motivations also shifted during illness, with fewer citing safety, 46 versus 42% after illness, and more influenced by family recommendations. Overall, these results suggest that infants of caregivers presenting to the ED for low acuity illnesses report low adherence to safe sleep practices, which worsen during and after illness. Future studies should explore targeted illness-specific anti-supportive guidance to reinforce safe sleep practices during and after illness. I'd like to thank my mentors and co-investigators who helped with this study, as well as the patients and families who participated in the surveys and follow-ups. Thank you.